Are you ready to take full control of your physical, emotional, and spiritual health? Are you ready to experience great success in your life? Health Talk with Dr. Diane, MD, will teach you the tools and strategies to help you take control of your health and inspire you to live your best life. Now here is your host, Dr. Diane A. Thompson, MD.
Welcome to Health Talk with Dr. Diane, MD. This is the show that is designed with you in mind. The goal is to bring you information that may help you to have a healthier, happier, and more inspired life. I am your host, Dr. Diane A. Thompson, MD, and as always, it is my pleasure spending time with you on this broadcast with the goal that you may learn something that may take your health and or your life to a higher level. I do want to remind you that the information presented is for educational purposes only, and no part of this broadcast should be used for diagnosis or treatment. Please seek the advice of your healthcare provider before making any changes to your health. Of course, I want to thank you again for joining me this week. I really appreciate the support that you've shown this show. It is my mission to continue sharing quality information that will make a tremendous difference in your life and your health. I am happy to say the show is in syndication, and you may go to my website at drdianethompson.com to get details of the listings. The website again is drdianethompson.com. I also invite you to come on over to my Facebook page. We have a very active community, and the page is facebook.com/Dr. Diane A. Thompson. Please drop by, like the page, share a comment. I would really love to see you there. I'm also on Twitter, and the Twitter handle is at Dr. Diane MD. That's DRDIANEMD. So many ways that you can be in touch with me, and I look forward to that. For today's show, we are bringing some attention to breast cancer. And it's such an important thing to discuss because so many women and their families are affected by this. The American Cancer Society, their 2013 estimate is that over 230,000 new cases of invasive breast cancer, as well as over 64,000 additional cases of in situ breast cancer is expected to be diagnosed. They've also estimated that almost 40,000 women were expected to die from breast cancer. So something we really want to bring some attention to. We want to help women learn how to quickly get diagnosed, look at their treatment options, look at support and resources that are available to them. And we're going to share information with women who have gone through this themselves, see what they use to survive and thrive, and perhaps you can use that same process as you go through this as well. In today's show, we're very fortunate because we have Dr. Sandy Goldberg, and Sandy Goldberg is a nutritionist. She's the on-air nutritionist for NBC Chicago, and she is also a breast cancer survivor, and she went on to form a foundation to help other women, and I think this is such an awesome thing, such a beautiful thing that she survived, she's thriving, and she also went to do something about it to help other people. I think it's such a wonderful story, and I'm going to share that with you. So we're going to take a short break, and when I come back, I'll have that interview, so you don't want to miss that. So we'll be right back.
Listen to Health Talk with Dr. Diane, MD, for tools and strategies to live a healthy, happy, and successful life. For details, go to drdianethompson.com. That's drdianethompson.com. Like us on Facebook, facebook.com/Dr. Diane A. Thompson.
Dr. Sandy Goldberg is seen weekly on NBC Chicago, where she is the on-air nutritionist for the program Food for Thought. She's also a breast cancer survivor and the founder of a silver lining foundation, which ensures access and treatment to underserved individuals affected by cancer. Dr. Sandy Goldberg, welcome to Health Talk.
Well, thank you so much for having me.
I am so excited about this interview because, we are bringing awareness to breast cancer. And I love to talk to people who have not just survived, but have thrived and have actually gone on to do something about it. But I want to go back with you to the year 2000. That's when you got that diagnosis. And I know there are many of our listeners who are probably going through this right now. So take us back to that time and share that experience with us.
Well, I consider being diagnosed with breast cancer as joining a club that I never wanted to be a member of. That's for sure. And I remember that I had gone in for a mammogram, my regular annual mammogram. I went back to my office, and I got a call saying, come back. And I went, I can't right now. And they went, no, come back right now. I went back. I was ushered into a room with a couch. So automatically I thought, this does not sound too good. And that's when the radiologist came in and told me that I had been diagnosed with breast cancer. And I must confess, as I'm sure all of your listeners feel, that I felt as though I had been hit by a bus. It was an experience unlike any other, but I must tell you that it changed my life, and not for the bad, but for the good.
Wow, and we'll talk a little bit more about that because there are people out there who have gotten devastating news, and unfortunately, it really knocks them down and they really have trouble getting up. And that's one of the reasons I love to talk to people who can look at the positive in the situation, because we sometimes really need to focus on that so we can do better. So when you say that it's helped you, not for the bad, what do you mean by that?
I discovered a lot about myself and about my life, to be perfectly frank with you. I was one of those blessed individuals. And remember, we're going back 14 years ago. So what I'm going to say now is even more relevant than it was then. I had great insurance. I had the support of a husband, and we were married 5 months when I was diagnosed. I had support of my coworkers and my family. And frankly, I almost didn't have time to think about it, because by the time I got back to get my diagnosis, to hear of my diagnosis, my surgery had already been scheduled. And so I went through the surgery, which of course is challenging, and I started in treatment. And I ended up going to a meeting of the American Cancer Society here in Chicago with my oncologist. You might be able to tell that I'm not the shyest person in the world, and I was sitting in that meeting, and I said, again, coming from a perspective of being on air at NBC here in Chicago, I said in the meeting, where is your media? Where is your outreach? You have a wonderful website. Where is your television? And they said to me at the American Cancer Society, make a show. And I went, I will. So I went back to NBC. I talked to my boss, and I said, this is what I would like to do. And created a cable show, a call-in cable show with the American Cancer Society, in which I was the host. And I interviewed specialists in the field of cancer, not just breast cancer, but across the board. And we answered calls live on air. What happened in a very short period of time is this little show took traction, and it was over 13 weeks. The number of calls outpaced the time of the show. So I would call people back afterwards, and I learned two things. Number one is that the callers were using our show as their primary care physician. And when I would make suggestions from this protected, wagon-circled world that I lived in, people would tell me they couldn't take my suggestions because they felt that they weren't worthy, because they had no insurance and no finances. And that broke my heart. And I came home one night, and I said, my husband said, how are you? And I started crying, which I normally don't do unless I'm watching a television commercial. You know, the dog that gets lost in the rain and the little boy is trying to find him.
You're one of those.
Yeah, exactly. I sit there and I cry. And So my husband said, as I'm telling him what's going on with the show and the calls, he said, so what are you going to do about it? And from somewhere, I said, start a foundation. And he said, then stop crying and do it. And I said, I will. And then I amended it to say, we will. And we started a Silver Lining Foundation. It's almost 13 years ago at our kitchen table with one donation. And it has grown over the course of years to 5 programs, at the heart of which is our program called Buy a Mom a Mammogram. And what we do is we fund the entire spectrum of breast health testing, from screening mammograms through biopsy, for uninsured and underinsured women at one of our 10 partner hospitals here in the greater Chicagoland, Elgin, and Rockford areas. So it changed my life. I would not, going back to your original question, I don't know if I wouldn't have known, but when you are confronted literally with people who have no place to go and you have everything, how can you not move forward, and how can it not change your life?
That is awesome that, as I said, there are many people out there who have gotten a diagnosis like this or any other type of diagnosis, and they simply move inward, and rightly so, to take care of themselves. Sure. I think that it's an extra special someone, though, who's able to say, you know what, I'm actually going to do something about it to help someone else. So I applaud you for this.
I thank you for that. But, it's very interesting because when we all get that diagnosis, and I think I can use the word all, we do go inward. And it's a very good point that you made. We do go inward. We examine our life. We examine our future. We examine the changes in our body. We examine our relationships with our significant other. As I said, I was married for 5 months. I tell people I got it right the second time, frankly. But I was married 5 months when I was diagnosed. I was nervous, and I shouldn't have been. But what I remember the most, when I was sitting and I was reflecting on my life, and these words came out about starting a foundation, I remembered my mother. And I remember what my mother would always say. You see, I come from a generation, my parents were immigrants. At the end of each month, my father would write the checks, and my mother would explain what the bills were for. And I remember vividly my father saying to my mother, who is this person and why am I paying their rent? And the girls don't have braces, referring to my sister and myself. What's the orthodontist bill? And my mother would say, in her language, but translating for your listeners, we are all family, and we have to help each other through the tough times. And I remember my father was 6'2", and my mother was 4'8", and he would say to my mother, it's okay, I was just asking. And I remembered that phrase, we are all family, and we have to help each other through the tough times. I also remember when I would come to her with my problems, especially in my teen years, she would say to me, there is always a silver lining. So in essence, what we do is a continuation of her philosophy, and we consider this foundation to be her legacy.
Oh, that's wonderful. I mean, kudos to your mother for instilling this type of thinking in you. And also, to your husband, because I will tell you what, at being married for 5 months and getting that diagnosis, unfortunately, there are women out there whose relationships have fallen apart because of this. So
yes, indeed. Yes, indeed. And it is an enormous change in life. I mean, it's enormous. And I had the most supportive husband on this planet, bar none. And you have the support, and you have the love, but you have to look at yourself. I mean,
right.
It's a change. And it takes time to get comfortable.
Did you draw upon anything else as a source of strength? So for women that are out there going through this right now, and perhaps they don't have the support of a husband or the sage advice from, a mother to guide them, were there other things that you found helped you during this period?
I think each individual, and that's a great question. All of us are different. I've found for many of the women that I have come in contact with, hearing of someone else's story not being afraid to reach out. There are marvelous, marvelous support groups and groups that go beyond tales of how unhappy and how sad, but really how to do something with our life. And I mean our life not necessarily going out in terms of a broader sense, but our life going forth from this altering situation. I personally think that once we get used to having this diagnosis, and it does take time, because I'll tell you quite frankly, my first year after being diagnosed, every time I coughed, I thought it came back. And we have to get past that. But what we need to do is advocate for ourselves, not to be afraid to reach out, not to be afraid to ask questions. I read several books on the breast cancer experience. A few resonated very closely to me, because of my psychodynamic. Everybody's head is different. Some people care not to share. Other people want to do something. Other people want to be in a group. It depends on the individual.
If someone's listening in right now who's going through this, and you just had to just summarize 3 things that you think, having gone through and actually, as I said, not just survived but thrived and went on to do something about it. For someone who's listening in right now who's struggling with this, you've given us a lot of tips already, but if you had to put 3 of them and say, these are what I think may help you as you're going through, what would those be?
Get outside of yourself. That would be number 1. The tendency to draw inward, as you rightly said, is there. Get outside of yourself. Number 2, be grateful for the diagnosis and the technology and the treatment modalities that we have now. When I was diagnosed 14 and a half years ago, I immediately thought about my aunt and my cousin who were diagnosed many years earlier who did not survive. We are at a time that a breast cancer diagnosis is not a death sentence. And number 3, be an advocate for yourself. The medical system, as we all know these days, and always, but these days for sure, is very, very challenging. Do not accept. Do your homework. Say if you're concerned. Reach out to other individuals, certainly in the medical community, to clarify whatever information you might need. I suppose what I'm saying really is being fearless in a way.
I love that. And, the idea of being an advocate for yourself, that is so important. I've had patients come to see me for something else, and maybe they had gotten a breast cancer diagnosis recently. And as you ask them about the plan for treatment, they are not sure what was said to them. I didn't really understand what
right.
The doctor said, and I'll say, well, why did you walk out of there if you didn't understand? So you're so right. This is a time of confusion. People are very worried, and they may sit there in their medical terms going over their heads, and you really have to advocate and say, look, I don't understand what you're saying. Explain it to me so I can understand, and so forth. But yeah, that's really important in a time like this. So I think that's great advice and a great time to take a short break. But you don't want to miss the rest of the show, because when we come back, Dr. Goldberg will share with us more about a Silver Lining Foundation. Perhaps you, the listener, may be able to benefit right where you are right now. So she'll share a little bit more about the organization. And also, I'm going to take advantage of the fact that Sandy Goldberg is trained in nutrition. She's a nutritionist by trade. And I'm going to have her share some dietary strategies to help reduce breast cancer. So you don't want to miss that. We will be right back.
Dr. Diane A. Thompson is an author, a dynamic speaker, and a workshop leader. If you would like to hire her to speak at your event, please visit www.drdianethompson.com. Also, sign up for updates and for her free ebook on stress at www.drdianethompson.com. That's www.drdianethompson.com.
Listen to Health Talk with Dr. Diane, MD, for tools and strategies to live a healthy, happy, and successful life. For details, go to drdianethompson.com. That's drdianethompson.com. Like us on Facebook, facebook.com/Dr. Diane A. Thompson.
If you are just joining us, welcome to Health Talk with Dr. Diane MD. My guest today is Dr. Sandy Goldberg. Sandy is an on-air nutritionist for NBC and the founder of a Silver Lining Foundation. And this is an organization that is aimed at ensuring access and treatment for underserved individuals affected by cancer. So can you tell us a little bit more? So that, people listen to this show all over the country. So for someone who's listening in, how would they benefit from your foundation? How would they? What would they do? What's the first step? Who would they contact? And how would you be able to help them right where they are?
Well, our goal ultimately is to be able to provide cost-free breast health testing for all of your listeners that would need it, uninsured and underinsured. What we can do, certainly in your listeners in the greater Chicagoland area who are uninsured and underinsured, we can certainly be of help. We have women that come to us from Illinois, Indiana, Wisconsin, Michigan, and even a few from Ohio. Being uninsured does not mean that one cannot get tested, especially in this area. However, for those of your listeners who are outside of this demographic area, I encourage you to call us at a Silver Lining Foundation, since one of our programs is precisely what you are asking about. It is a group of organizations, several national in scope, where we can provide your listeners with phone numbers in their area. Generally it's an 800 number actually, for them to call and access information in their particular demographic area. See, I think what's very important is that all of us recognize the fact that there are 11 other months to the year, not just October, which is identified and wonderfully so as Breast Cancer Awareness Month, but access to testing and the need for annual mammograms is throughout the year. Might I give our phone number? Would that be all right?
Please do.
Okay, for information and to talk to somebody directly, and I will tell you and I will share, we don't have voicemail in our office because I don't like it. So when you call a Silver Lining Foundation, you will get a live person. If it's after hours, it'll be me because those calls hunt to my cell phone. And that number is 312-345-1322. And our website is asilverliningfoundation.org. Again, asilverliningfoundation.org.
And for the listeners, I'll make sure that information is on my Facebook page, which is facebook.com/Dr. Diane A. Thompson. So you can have a direct link to this foundation's website. The other thing I wanted to know, I know you do have an upcoming event for your foundation, so share that information with us.
Oh, yes, our annual gala. We call it a Sterling event. And it is this coming Saturday, actually, on the 11th in Chicago at the Hyatt Regency McCormick Place. It is completely underwritten. So all of the proceeds from the evening support the programs of the Silver Lining Foundation, including our mammography program and a new program that we just started called Survive to Thrive. And that program has been designed specifically for uninsured and underinsured survivors who have no place to go to make sure that they're okay. Imagine how dreadful that must be to have that lurking within us. We expect around 450 people. Our anchors on the weekend morning show are emceeing, all of them. So it's going to be a blast. We have a great live auction, great silent auction. It's a fun evening, as I like to say, for a great cause.
And I encourage the listeners to go ahead and support that. As you hear, it's for really a worthy cause. And I'm going to spell out the date. I can't tell you how many times we've had, guest on, and they'll say a date, and someone will call or contact me a year later thinking it's that year. So it's this Saturday, and it's October 11th, 2014. These shows go into archives, so next year someone will be listening to it. So that is great, and I will have, again, that information on my Facebook page, and we'll share that with social media. I think it's such a worthy cause. There are so many women out there who could benefit from this.
And if any of your listeners have an interest in our expanding into other areas of the country and have suggestions, frankly, and connections to institutions of a like philosophy to ours, we would be more than willing to explore those options. Our partner hospitals are very special institutions. When we go in with the potential of partnering with a hospital, we check everything that you would normally think of checking: the equipment, the age of the equipment, the people who are utilizing the equipment, the techs, the docs, their certification, everything. The most important is how are our silver lining ladies going to be treated when they walk in the door. That's the most important thing. No one wants to be treated like a number. No one wants to be treated as though they don't care. And that is something that all of our partner hospitals pay very, very specific attention to. And frankly, that's one of the reasons that we don't have voicemail. Getting phone calls from people who have gone through our system is wonderful. And why? Because we get the calls much of the time. And imagine this, right? You're picking up a phone and someone's had a mammogram and they call you and they go, I'm okay. I'm okay. Because we think about saving.
Yeah, that's awesome. Wow. Okay. So, again, as listeners, this is a great foundation to support and to, seek out information. Perhaps something there may be of benefit to you. And perhaps you, if you're going through breast cancer and you're looking at a way to helping others, this may be a way to share this kind of information in your own community. So I'm going to switch gears now and go to our final question, which is the tip of the week. I usually love to leave listeners with something that they can walk away with, very tangible information that probably they can apply to their lives. And I'm going to take advantage of the fact that you are a nutritionist and we are bringing awareness to cancer. And so I wonder, are there dietary steps or strategies that people are able to use to help reduce breast cancer?
Absolutely. And these are lowering risk factors. And what I would recommend very, very strongly is, number one, to ramp up the amount of fruits and vegetables that you're eating during the course of the day, a minimum of 5 cups. I would focus on foods that are high in omega-3s, such as navy beans, fishes, cold water fishes, soybeans. Those are all great sources. I would cut down on saturated fats, red meat. And although many of us love to barbecue and we love all those crispy ends on our barbecued foods, don't eat them. Very important. What I would also do is make sure that you keep your weight under control, because there is a higher occurrence of breast cancer in postmenopausal women who are overweight. Don't smoke. If you smoke, stop. If you don't smoke, don't start. And if you do imbibe, if you do drink alcohol, I would seriously consider lowering the amount of alcohol that you drink, if any at all, and also to lower the amount of fat in your diet to under 25%.
Wow, great advice there from Sandy Goldberg. I really thank you so much for being on the show. Can you share one more time your contact website?
Sure. Our website is asilverliningfoundation.org.
Wonderful. And for our listeners, I'm going to leave you with a quote of the week, like I usually do. And this one, actually, the author is unknown, and it says, "Forget all the reasons it won't work and believe the one reason that it will." And I think that's such sage advice. Again, thank you for joining us this week. Please join me again next week. And remember, as I tell you every week, your health is your wealth. So please do something healthy for yourself.
You have been listening to Health Talk with Dr. Diane, MD, on 1570 AM WIGO. Please tune in every Thursday at 6 p.m. Eastern Standard Time for the best in inspirational health information. If you have missed any part of this broadcast, would like to find out more about Dr. Diane A. Thompson, or would like to receive her ebook on stress, please go to drdianethompson.com. That's drdianethompson.com. And like us on Facebook at facebook.com/Dr. Diane A. Thompson. Remember, your health is your wealth, so do something healthy for yourself. Have a great evening.